Hey everybody, I am super excited that you clicked on the arthritis piece, because how many of us suffer from arthritis? Put your hands up high. Exactly. If you're like me, it's not one joint, it's multiple joints, right? Because as you age and the hair gets white, guess what happens? Arthur comes knocking on your door, and in he comes, invited or not, right? So what we want to talk about with arthritis is that I want you to keep your own joints. I don't want you to get joint replacements. Does that make sense? Yes. But if we can regenerate and rebuild our own joints, that's healthcare of the future, right? So that's what we're talking about here. And more than likely, if you've clicked on arthritis, you've probably clicked on one of the other ones as well. So what we do differently at Advocate Integrative Medicine is that we go through a thorough consultation, we do a functional exam and functional diagnostics. What does that mean? That when we look at your joints, we look at the other surrounding joints and to find out what is exactly going on. Because if you're having knee arthritis, you probably got a pelvis issue and you got some degenerative hips. And if you've got knee arthritis in one knee but not the other, now you're telling me you had an old injury and it's knocked things out of alignment. Fair enough? So with arthritis, it's a bit of a different one to look at. You have joint degeneration, but typically it's not symmetrical. It's not throughout the entire joint. It may be on one side of the joint but not the other, and it's not bilateral, which means opposing joints, knees on the right or left, hips on the right or hips on the left. The big thing that we're going to do different with you folks is that we have a team approach. We're going to go through each step of a consultation, a functional exam, and functional diagnostics, much like a stress test for cardiac patients. We're going to stress your tissues in the exam and in the diagnostics to see exactly which tissue is the driver that's causing your pain. Is it a kneecap issue in your knee? Is it a meniscal issue? We need to know the difference because the way that we approach it's going to be different. Fair enough? If I have a shoulder issue, is it the posterior aspect of the shoulder or the anterior aspect? I need to know this so that it changes how we treat. Here's the difference at Advocate Integrative Medicine. We have a team approach. When we run through the consult, the exam, and the diagnostics, our medical team, medical doctors, our nurse practitioners, our chiropractors, and our technicians, we all sit down, one table, review all of your information, your consult, your exam, and your diagnostics. And as a team, we come up with an approach to regenerate, revive, rebuild, stabilize, and return it to normal function. That's the difference on what we do. We use a team approach and we use a team concept of treatment. And who benefits, folks? You do. Where else can you get 5 opinions for one price? Exactly, nowhere. That's what we do different. We regenerate, we rebuild, we restore, and we return a joint to normal function. And I hope that I can keep you from a joint replacement. That's what we're trying to do. Because once you have a joint replacement, you've lost a percentage of function for the rest of your life. We all know this. So this is what we're going to do. If I have arthritis, we're going to focus very heavy on regenerative medicine. We want to try to rebuild and regenerate and regrow that joint. That makes sense to me. But one of the things that helps the most with regenerative medicine is bracing. In other words, let's unload the joint and allow the regenerative medicine to do what it's designed to do. That makes sense. And then we're going to rehab that joint. We're going to strengthen and we're going to stretch around that joint to stabilize it and to return it to normal function. Do you notice I use that word an awful lot? I use the word function an awful lot. Exactly, because function equals health. If I can raise your level of function, I've raised your level of health. That's what life is about. Chiropractic restores normal biomechanics to joints, and more importantly, it restores normal neuroflow. In other words, the information that starts on your brain, it needs to get to the tissues, and that's what chiropractic is all about. Medical care, we're going to use that appropriately to get you past speed bumps and humps, whether it's trigger points, whatever else we need. It's a temporary fix to get you to the next point. When we combine all of these types of treatments in a functional treatment plan under a team approach, you win, folks. You benefit. That's why we put this model together, and we're doing it for you. So if you click below, we're going to gift you an examination and a consultation at a drastically reduced fee than we normally charge. Folks, please take advantage of it. Take advantage of this opportunity and allow us to look at you, to evaluate you, to come up with a team concept on how we can get you better, faster, less symptoms, less cost, and keeping your own joints. Folks, that's critical. We have a team concept, team treatment plans, and you benefit. And we're at Advocate Integrated Medicine. This is our phone number. This is our website. Take advantage below, click, and give us a call. And I look forward to the opportunity to take care of you.